So, good morning, everyone. I'm Jennifer Go, and I'm going to be taking you through part 2 of this webinar on conducting a review. I'd like to acknowledge the traditional custodians of the lands on which the University of Newcastle campuses stand, the Awabakal, the Darkinjung, Biripi, Worimi, Wonnarua and Eora nations. I pay my respects to elders past, present and emerging, and I extend my respect to any Aboriginal and or Torres Strait Islander peoples here today or watching this recording. Now I'm going to be turning off my camera because in the recording, I don't want my talking head to be captured and obscure any information that is shown on the screen. So I'll turn that off now. Before we start, I just wanted to recap what Fiona did last week. So Fiona talked about the systematic review process, which is shown in this timeline here. She talked about developing your question using the different frameworks. She looked at registering your protocol and the different guidelines and standards that you should follow when you're following the gold standard of conducting a systematic review. She also touched on developing a search strategy, identifying your keywords, talked about subject headings, which we're going to be using today. She talked about some of the tips and tricks in using truncation, for example, which is the asterisk, Boolean searching, nesting and proximity searching. Okay, now I'm going to be running through the use of these techniques in searching today. So the bulk of this session will focus on selecting and mainly searching some of these resources. Now, although the focus is on searching the health resources, the process and the search tips that you see today are transferable across different disciplines. So let's look at the question that Fiona developed last week to refresh our memories. So the question was, what is the impact of stay-at-home restrictions on levels of physical activity during the COVID-19 pandemic? And these were the concepts: stay-at-home restrictions, physical activity, and COVID-19 pandemic that she picked out, and the different keywords, synonyms, and related terms for each of those concepts. Now you'll notice that I have color-coded each of these concepts, but you don't need to do that in your own research. I've done this to assist with my demonstration, and it'll become clearer at the end. Okay, so as part of the systematic review process, you need to document your search. So before you actually start launching into any search of a database, I'm just going to go back to this tab here, identifying keywords and synonyms, where we've actually got a search planner here that I would advise you to keep handy. So it's good for recording the different databases you've searched, any results that you've found, because this would be a very handy document to have once you start the writing up process. Okay, so coming back to choosing resources. So the next step in the process is to select what resources to search. It's important to search a wide range of resources shown here. Now, this is not an exhaustive list, but as you can see, we have provided links to different subject-specific databases, grey literature sources, theses, that sort of thing. So if you're conducting a systematic review of interventions in the health sciences, then the 3 most important databases to include in your sources searched are Medline, Embase, and the Cochrane Register of Clinical Trials. Okay, so that information is documented here in the Cochrane Handbook for Systematic Review of Intervention. So that's if you're following the gold standard. Remember, if you're doing a proper systematic review with a group and you're following the gold standard, these are the guidelines that you must follow. If you are not doing a health review, or if you're not doing a review of interventions, always be mindful of what your research question is, and that in turn would help you determine which databases are the most appropriate to select for your review. So the other two databases I'm going to show you also are CINAHL Complete and Scopus. Now Scopus, I'm going to show you because that doesn't map to subject headings like Medline and CINAHL do. So it'll be a good opportunity to show you how to apply the other different search techniques to searching. So searching, as mentioned by Fiona last week, it's a very iterative process. So nobody, not even the most experienced researcher, is going to get it right the first time. So it'll take many tries before you actually have a search strategy that you're eventually happy with, and more importantly, that retrieves relevant literature. So let's now look at Medline. This is Medline. It is hosted on the Ovid platform, as you can see. It defaults to the advanced search mode, and it automatically maps to subject headings. So what are subject headings, you might be asking, and how do they get assigned? So when papers get submitted for publication in journals, a person who reads them has to determine what they are about, and they assign headings from a list of terms used to describe the paper's contents. So let's talk about something like a humble USB, okay? Someone writing a paper about USB might describe it in their paper as a USB. Someone else might describe it as a pen drive, and yet another researcher might describe it as a thumb drive. So the person or the indexer who reads these papers will have to decide through looking at their list of headings, what is the most appropriate term to assign to all these, to index these papers with, that encompasses these different terminologies. And they might decide, okay, universal serial bus is the heading for this object that is described. Now, universal serial bus is not a term that any of us would use in everyday language or even think to use in keyword search, but this is the term that is applied to all papers using these different terminologies to ensure uniformity in indexing. Okay. Now, because indexing is done by a person, it's not a perfect process, right? Because in the process of indexing, some concepts may not be deemed as important as others. And so therefore, papers may not be assigned certain headings that you might expect them to be. Also, subject headings get reviewed often and they change from time to time. So when you're conducting a review, it's important to use a combination of both keywords and subject headings to ensure that you capture as much of the relevant literature as possible that use these different terminology. So in Medline, the subject headings are known as MESH. That's MESH, and they stand for medical subject headings. So the best way to search Medline in the Ovid platform is to search each concept separately. And you combine the searches using the Boolean and or in your search history here. So we're going to start with our first term. Let's just go back to refresh our memories of what the terms are. So the first one would be isolation. So you'll notice it's brought back two headings, reproductive isolation and social isolation, as well as allowing us to search the keyword isolation. Let's have a look at social isolation. You'll notice that on the right-hand side, there is a scope note. Always read the scope note before you actually select a term to search on. So this gives you the scope of what the term covers. Okay, so it's separation of individuals or groups resulting in the lack of or minimizing of social contact and or communication. So that pretty much sounds like the concept we're after. And it's used to include terms such as social exclusion, etc. So this sounds like the term that I want. However, we also need to look at the explode and focus boxes here. Before you decide to explode or tick focus, you need to have a look at the term within the hierarchy of the different terms, okay? So let's scroll down to where it says social isolation. You'll notice that there is a minus sign there. So that means we've already opened it up. And the other term that is listed under social isolation is ostracism. Now, if you were to explode that term, not only will it include the term social isolation in your search, you will also be searching the term ostracism. Now, ostracism isn't really something that has to do with stay-at-home restrictions. So it's not something that I would explode. So always be very careful to look at what you're exploding before you actually tick on the term to explode. There might be other terms. For example, I'll show you a term later on that would be appropriate to explode. Now, focus means that you want this concept or this term to be the main focus of the article. So you're essentially going to narrow your search, whereas explode obviously will expand your search, focus will narrow your search. Again, be very careful, because as you're starting out searching, you don't necessarily want to exclude potentially relevant papers if they're not the main focus of the article. So advice would be, when in doubt, don't click those terms. Don't click those boxes, sorry. So we've decided, yes, we want the term, sorry, went too fast there. We decided we wanted the term social isolation, we don't want to explode. So I'm going to continue with that search. Now here you're presented with a list of other subheadings. So if we were looking at, say, the psychology of social isolation, you could tick that. But as you're starting out with your search and getting used to your searching and wanting to find as much literature as possible, I wouldn't actually tick any of these. They will all be searched anyway. You don't even need to tick include all subheadings because it'll automatically include them. So I'm just going to continue at this stage. So that adds the term, the heading, social isolation, to our search history. Now, how do you tell visually that you've searched a subject heading? You see this / here. That / at the end of the words indicate that that term has, or that term or terms have been searched as a subject heading. Okay. Now let's come back to our keyword searching. So we've done isolation. We didn't have a heading called isolation. So let's look for the keyword isolation. So Medline gives us the option of searching that word as a keyword. So that's what I'm going to do. That will add to the search history. Now you'll notice, again, the visual indicator that I've searched as a keyword is .mp. So that means multi-purpose field. So it's searching across the title, it's searching for that word isolation across the title, the abstract, and any other keyword headings. So let's have a look at an example here. We notice that the term isolation is in the conclusion. That's why it's highlighted. So when you're doing a keyword search, it's searching the keyword headings, the abstract, and the title for that word. When you are searching a heading, what it is doing is only searching one specific field, which is this mesh field here. Okay, so it's a very targeted search. Now, the thing with Medline too is it's very sensitive, and if you're doing a keyword search, it doesn't take into account plurals or singular. Okay, so if you search a singular, it doesn't take into account the plural and so on. So what you'd need to do in this case, if we're looking for isolation or isolated or something like that, then the best thing to do would be to use the wildcard to take into account those different endings. Okay, so let's go search. So that allow me to search again as a keyword with the wildcard. There's nothing else there that seems relevant. So and you notice we've got more, which is good in a way because we want to encompass as much literature as possible. Let's look at the term quarantine. Oh, quarantine. So we do have a subject heading. Again, read the scope note. Limited freedom of movement of individuals to risk spread of communicable disease. Used for things like stay-at-home orders, self-quarantine, lockdowns. Okay. Again, that sounds like the term we want. Is there anything to explode? That's relevant. There is nothing there. There's no plus sign. So nothing to explode, and we don't want to focus. So I'll just continue. Again, I'm not going to select a heading. I just want to search everything. So that adds to our search. Now remember, I talked about singular and plurals in keyword searching. If we search quarantine as a singular, I'm not going to select the quarantine subject because I've already selected that. I just want to search the keyword. I get that many results. If I search it as a plural, I get that many results. So again, using the wildcard would be a good idea. So I don't have to sit there thinking, okay, there might be someone who says, you know, talks about quarantining or things like that, that might be relevant. So again, we're going to be using the wildcard. And the wildcard is applied to your keywords. Okay, so we get that many. So you'll notice that you've, the first few lines, the top lines have disappeared. So you just need to expand your search history box. I'm going to get rid of the terms isolation because I've already accounted for it here. I'm going to get rid of these two here because I've already accounted accounted for it here with the wildcard search. So I'm just going to remove those. Now, I'm not going to go through every single search term in the interest of time. So I'm going to go to the next concept, which was exercise. Okay, so exercise, again, read the scope note. Physical activity, which is done on a regular basis. Okay, let's go back. So that is used for things like physical activity, aerobic exercises, exercise training, etc. Remember, have a look at the term with its position within the hierarchy to determine, or the position, yes, within the term hierarchy to see whether there are relevant terms to include in the search. So here we've got cool down exercises, exergaming. Again, you'll have to read all the scope notes. Under exercise, we've also got physical conditioning, running, walking. So I had a quick look at these before and they look like relevant terms to include in my search. So this is one term that I would explode to encompass all these other terms. Okay, so when I do that, I go continue. Again, I want to search all these headings. Now you will notice in our search history that you've got EXP in front of exercise. That indicates that we have exploded that search subject heading. Okay, so again, that's a visual that you've exploded that subject heading. Next one I'm going to look at is physical activity. So it's mapping to the term exercise. We've already selected that. So let's go physical activity. Again, just in the interest of time, I'm just going to select that, but in a perfect world, I probably would have used truncation. Physical fitness. We have the term physical fitness. Again, read scope notes. Can't stress enough the need to read scope notes and look at its position within the hierarchy. But again, in the interest of time, I'm just going to select that one and also going to search truncation. So that will find terms such as physical, physically, active. So that will count for physically active, physical activities, physical activity. Okay, so let's just select that. Right. And the last set of our terms would be to do with COVID-19 pandemic. This is where you could use proximity searching as well. If we did COVID-19, hyphenated words in Medline makes no difference. They're searched the same way. Okay, so we do have a heading for COVID-19. I'm going to select that. Proximity searching. So within Medline, we can use what's called the adjacency operator. So you can search within a number of words of each other. So here we could have COVID adjacent 5. So it has to be, the word COVID has to appear within 5 words of the word pandemic. So that adds to the history that way. So that's searching for the words COVID within 4 words or 5 words of the word, no, within 4 words of the word pandemic, 5 because it accounts for this other word, in any order, in title, abstract, etc., in all these different fields. I'm also going to do coronavirus, the DJ5 pandemic. So again, that has added that line down there. So now we've got to group our different concepts. Okay, so lines 1, 2, 3, 4 are everything to do with our stay-at-home restrictions. Okay, so that's, remember I color-coded it, that was my lilac colored block. So all these terms we will search with the OR because they all are synonyms, related terms. Exercise, physical activity, physical fitness. So 5 to 8, they're all our synonyms, related terms to do with our concept of physical activity. So there are green block, they would be searched using the OR connector. And lines 9, 10, and 11 are all the terms related to our COVID pandemic concept. So they were the blue block of words, so they're combined with the OR as well. And then what we do is combine lines 12, 13, and 14 because there are different concepts with the AND. So this is the number of papers that contained these subheadings or keywords. Okay, so ultimately what we're trying to do is end up with a search like that. So that's a block of words for describing the stay-at-home restrictions. That's our block of words for describing exercise, physical activity. That's our block of words for describing the COVID-19 pandemic. And that's our final search result. Okay. Were there any questions though before I move on to the next database?
There's nothing unanswered at the moment. Thanks, Jennifer.
Okay. Now I'm coming back to this guide here. You'll notice that we have a form called Quick Search Guide for Health Databases. Each database operates slightly differently. So have a look at this document. We've listed the main, the common databases that people search and which symbols they use for truncations, whether they enable you to do phrase searching, that sort of thing. Okay, so it's a good thing to look at because proximity searching, especially with the Ovid databases, it uses the adjacency term, whereas things like Scopus uses the within, so W. So you'd need to be aware of all these different things when you're searching the databases. So this is a good document to refer to. Otherwise, when you're looking at a database, you can always look at the help section. There'd be further information about how you do advanced searches. So the next database we're going to look at is Embase. Now, Embase runs on the same platform as Medline on the Ovid platform. Again, any search that you construct, you have to do that same or equivalent search in the other databases. Now, because databases have different ways of being indexed, the terminology that they might use might differ, but as long as the concept's the same, that's what you need to search on. Okay, so for example, if we're looking at, again, isolation, So we've got, again, things like social isolation, but I'm not sure if are we searching Embase? We are searching Embase, just making sure. Okay, so again, it's coming up with the same terms. So social isolation, keyword isolation. No, it's not doing, it's going back to Medline. I'm just going to close this no, I'm not going to close that Medline search. Let's try quarantine, see what happens. Okay, this looks better. Okay, the thing with Embase is the headings are, if you notice, are all in lowercase. So that's why it stumped me a bit before, because the headings didn't appear to be in lowercase. So that's sort of things that you sort of know as you become more experienced, you know the different quirks of different databases. So here you could see it's got not only the term quarantine, we've also got scope notes, explode, focus functions, but you'll notice that it's got an extra heading that wasn't in Medline, and that's home quarantine. Have a look at the scope note. So that really relates to social isolation, home isolation. Again, that would have things to do with the pandemic. So they relate again to our concept of stay-at-home restrictions. So I'm going to select these two. In interest of time, I'm not going to go and look at the hierarchy or anything like that, but for your searching, I cannot reiterate enough how important it is to look at the scope notes and to look at the position of that term within the hierarchy. So that's added the terms to our search history. So again, you're following the same process of looking then for terms in each of the different concepts. And you can also do the wildcard searching. Okay, so we have the term exercise. I'm going to explode because I know it will cover things that I want to look at, but again, always look at the term within the hierarchy. I'm just in the interest of time, again, I'm just going to do this. But why it is important, or I guess while you're initially conducting a search, it's good to actually search each one separately, because you can see the difference in results. Whereas here it's sort of unsure, you're sort of it's unclear where, you know, how many numbers you're getting for each set of results and whether that terminology makes a difference. So, but like I said, in the interest of time, that's what I'm doing. So this is what you would do again with your different blocks or different blocks of concepts. You'd combine them with your and or your or. Okay, so in this case, because they're different concepts, we'll combine them with the and. So that's just a very, very quick run through of these two databases, because I realize we're now at 10:38. Now coming back to Medline or Embase, you can save your searches. Okay, so you'd need to create an account if you don't already have one. I'm already logged in. So what you do to save your searches when you're happy with them is you tick them all, click save, name your search. Okay, so it says it saved your search. Now, when you go back in to look for your search history, you need to click on My Workspace, and it's not immediately obvious. So it's under My Searches and Alerts. Okay, not obvious at all, but there it is, webinar demo. Okay, so you can rerun this search later on, edit, that sort of thing. Okay, the next one we're going to look at is Cochrane Library. So the search box here, you've got advanced search. So click on the advanced search. Sorry, I'm flying through these now because we're running short on time. Have a look at Search Manager, because you want to do a combination of subject heading search and keyword searching, okay? So you'll notice here, if you click on Search Manager, that you have the ability to search either the mesh or the subject, the mesh, which is the subject heading, or just the keyword search here. So if you clicked on mesh, we remember one of our mesh was what, exercise. So it's showing us the term exercise. Now, what the Cochrane does is it automatically explodes any term that you wish to look for. So in this case, exercise, yes, we exploded beforehand, so that's fine. We explode that. If we didn't want to explode that term, you need to remember to tick single mesh unexplode, okay? Because the difference between Cochrane is that it automatically explodes all terms. So let's just leave that auto explode because we have done that with our previous search. So here you can see it says you've searched the mesh term exercise and it's exploded all trees. If we did quarantine as a keyword, this is what it's doing. Okay, so again, 307. Remember I said go to Search Manager, search keyword here, it's searching title abstract keyword. So let's go isolate, add to search line. Okay, and then how do you combine those two? So lines 2 and 3 are everything to do with our stay-at-home restrictions. So it'll be line 2 or, whoops. Line 3. So that's our stay-at-home restrictions. And then we do line 1 and line 4. Okay, so when we look at our final result, we get the default of Cochrane reviews, worth looking at, and the list of individual trials are here. So it's always worth looking at this because some of these may not get indexed in any of the databases that you're looking at. So the next one I'm going to very quickly cover is CINAHL. So again, CINAHL, like Medline, does allow subject heading search, but you need to remember to tick, okay? Because if you don't tick that box, suggest subject terms. If you just did quarantine, I can't spell quarantine. That searches as a keyword. Whoops. Okay. If you just do that, that obviously searches as a keyword. But if you remember to tick subject term box, it offers you the same options as it did with Medline, Embase, etc. Okay, again, you've got explode, and instead of focus, it's got major concept, which is essentially the same thing. That's the main concept of the article. You've got scope notes, read the scope notes. Again, you can look at the term within the hierarchy. We've got additional keywords. We've got additional headings here that we didn't have in Medline. For example, stay-at-home orders, quarantine. Okay, or you can also search as keyword. So again, in interest of time, I'm just selecting everything here. So your visual indicator that you've searched keyword is that or that. For your headings, you get the MH in front of your term. So that's an indication that you've searched your headings. And finally, Scopus. Now, Scopus doesn't have headings. You search keywords in any of these fields. So I've done this. So what you'll do is you can use what's known as nesting, is where you use the brackets. My cursor's not going where I want it to. So this is how you do it for your stay-at-home concept or your different keywords there. Okay, so I'm searching for the phrase. I've used wildcard searching, and I've enclosed them within the brackets. I'm going to search each concept again separately. So that would add to my history down the bottom. When I click edit, you can see my history is there. So my next set of terms, I'm going to search exercise. Again, I'm hit edit to see my search history. And then I'm going to do this. So that's account for physical activity, physical fitness. And you tend to get errors sometimes. I'm not sure why. So that's why I did this way, but doesn't seem to like that today. Worked fine yesterday. That's okay. Let's keep going. So that's where I've used the proximity searching using the W, because in Scopus, that's what it uses. So again, I click on edit. How do I then combine all these different lines here? Click on the advanced search, scroll down. See our search history here. So this is where you can combine the line numbers. So then here I go 1, oops, and 2, and 3. Okay, so that's the number of documents containing all these keywords. Okay, so those are those 5 databases. Now, let's have a quick look at the other sources, such as Grey Literature sources. So you might need to look for theses. So we have the UON thesis and dissertation guide. It shows you how to find not only UON theses, but also Australian theses or international theses. Okay, so it's always good to look at those. We've got different web resources depending, you might be looking for government policy or something like that. So we've got a few links here. Again, as I said, not an extensive list, but don't forget there also are the individual subject guides that you could look at as well. So after you've done your search, you need to document it. So you've hopefully downloaded that document and noted it all there. You also need to test your search. Okay, So are you finding, you know, relevant, highly relevant papers? Are those highly relevant papers also coming up in the search strategy of each of those databases? So you need, are they firstly indexed in those databases? If they are indexed in those databases, are they coming up in your search results? So that's another way to test. We have a checklist here for reviewing your search strategy. And we also have, this is an external module. It shows you how to run a test of your searches, so worth looking at. And also, when do you stop? That's a common question we get. When do you stop? Well, that depends. I mean, if you know your search is fairly robust, and you're not getting any more new searches, then that's probably a good time to stop. Also, there might be other factors. You might be working with a group. There might be constraints of budget, time. But again, if you're doing a systematic review, you're working with a group of people. That has to be a group decision. So you have to come to some sort of group consensus. Now, as you are collecting your references, you can also save them to your EndNote. We're not going to go through EndNote today. We don't have time, and it was never part of this webinar. But you do collect your references with EndNote. And you can also use EndNote to deduplicate your library, because there will be duplicate records in your library. So you can use EndNote to work through the deduplication process. And then once you've done all that, you can import your records to Covidence for screening. Now, Covidence is a tool that you can use to assist with your screening of your studies for inclusion into your paper. Okay, so we have different videos here, fairly extensive links of how you import to Covidence and how you use Covidence to screen on title, that sort of thing. Okay, so this is a fairly extensive list here, just go through that. Within 12 months or preferably 6 months of publishing your review, you should make sure that you rerun your search, see if there are any new papers that are published in that area. Okay, so we have some codes to show you how to update your search using the date fields, okay, within the common databases here. So just have a look at that. And appraisal, anything that you find, any paper that you find, you must always appraise to see if it's the studies are of the highest quality, whether their methodology is robust, that sort of thing. So we have a number of appraisal tools there that we've linked to. So they have checklists to help you decide whether a study has been done to the highest quality or is robust enough to include in your review. But again, as I said, if you're working on a proper systematic review with a group, there has to be some group consensus on your criteria. And when it comes to publishing, there are certain standards that you need to follow. So that's the PRISMA flow diagram. So this, remember I showed you that documentation for your search plan, that would help when you come to doing this step here. And there's also other links of where to publish and that sort of thing. So I know we've flown through this webinar, but as I said at the beginning, the bulk of the webinar was focused mainly as I said, the bulk of the webinar was focused mainly on searching the databases. So if you have any questions, always go back to your research liaison librarians. contact them and then they can assist you through next steps. So do we have any questions, Fiona?
Thanks, Jennifer. So we've just got one question about the recordings, which the part 1 is also already up on YouTube, so I can put a link in the chat in a minute. While other people are thinking about their questions that they're going to ask in the last 5 minutes, I've just launched a poll, which we'd really appreciate if you'd answer, because it helps us to make sure that our webinar series is meeting the needs of our students and helps us to identify ways that we can improve them as well. We just do have another question, Jennifer, you might want to talk about. What does MP stand for again?
Okay, MP stands for multi-purpose. So it just basically means it's searching across a number of different fields. So there are a number of different, it's beyond the scope of me explaining this in this webinar, but .mp basically means it's going to search across a number of different fields, which include the title, the abstract, and any other keyword related fields.
Okay, we've just had
other...
Oh, sorry, Jennifer.
No, that's all right. There are other fields that you could sort of specifically limit to, but again, that is probably a question for your research liaison librarian, because we can't cover everything in the webinar.
Yeah, I was just going to say there was a follow-up question about, is there a list of the abbreviations? And I know we don't have time to cover it now, but in any database that you're searching in, there's always a help section. And I know in the help on the Ovid platform, there is a section that lists all the different fields you can search in and what their 2-letter abbreviations are. So you can always have a look at those if you need to.
So let's go back to something like this. If you have a look at the search fields, search fields. There you go. There's the list of abbreviations there.
Thanks, Jennifer. That's great. I'd forgotten it was there as well.
So that's in Ovid. It's on the search field. So obviously the different databases will be listed separately. And I'm just going to post the link to the research librarian contacts, because there was a question about follow-up.
Yes, okay, I missed that one. Thank you. Yeah, so if you're a HDR candidate, definitely your research liaison librarian is the person to talk to. You can develop a really great relationship with them over the course of your PhD. They can help you with lots of different things.
Yeah, and if you're an undergraduate, in that same page that I sent you the link to, on the left-hand side, there's another link to the teaching liaison librarians. So that'll be people like Fiona and I.
Okay, I'm going to go ahead and stop the recording now, I think. Thanks so much, everyone, for coming. And thanks, Jennifer, for that really, really helpful search demonstration and other information that you gave us.
No worries. Thank you. Thank you, everybody, for attending and listening.